Hi everyone, welcome. This is another wellness talk at Lumina Massage, and today we have a special guest, Lindsay. The topic today is all about pregnancy and specifically neuromuscular massage. And Lindsay has been a recipient of this type of work. This is going on her second pregnancy. So Lindsay is a mom of a beautiful boy and one on the way. So you're at 37 weeks, is that right?
36.
Okay, 36.
Yes,
Almost there. Almost there. So Lindsay is a working mom. She is a businesswoman, and she definitely has had quite a journey of exploring what it means to take care of herself throughout her pregnancies. So I thought she would be a wonderful inspiration and really good insight. The reason why we were inspired to do this interview was because there's still a lot of physicians and doctors in the community that feel that prenatal massage is dangerous and that there's not a lot of video or record of moms speaking out into the community and really sharing with other people. You have blog posts and you have Yelp reviews and you have Google reviews, but there's something really special about video when you hear the experience of a woman and how it's really helped her. And hopefully this will be a tiny drop in the bucket in the future for physicians to really hear the voice of pregnant women and see what it is that they need, not just in massage therapy and neuromuscular, but other needs that they might have. So we're really hoping that this will help the medical community embrace alternative therapy and natural therapies and just really push it more and have those resources at their office, not simply say, you know, go and get a massage, but really be a little bit more educated and informed as to what the woman needs. So it'll be a safe experience for her as well.
Similar to athletes who have, you know, put their bodies through gruesome workouts and it's, you know, there's constant changes in movement. Our bodies are expanding internally. And so the massage and the pressure and the release and the moving the blood around and getting oxygen to the area, that's all helps the most. I mean, in my opinion, yes, stretching and exercise is a big part of keeping everything intact, but I think what you do and the massaging, and you feel it, you can feel it in me, you can tell when everything's tight, and you push through that and help me work it out. It's the same thing as physical therapy. People go all the time for physical therapy and they have all different types of techniques, and this is the same thing as that. And why wouldn't we allow ourselves to do this? That's the question. I don't know why it is taboo. It doesn't make any sense to me. It makes common sense to me to, you know, go and have someone work on your hips. I don't understand what the danger even is.
Right. So that's what we're gonna.
Even if you're, you know, if you're staying it's not like you're. I mean, you do the round ligaments and stuff, but just a foot massage, a back massage, your hands, like it calms you down. It relaxes you emotionally. It helps you physically. I don't understand what they think is so dangerous about it.
For those of you watching that are not familiar with getting prenatal massage, and Lindsay, again, this is her second pregnancy. So she is very accustomed to being active even before her pregnancy, and she did yoga. So she's very in tune with her body. But even if you're not, as Lindsay was saying, your body expands at a much faster rate than is normal in sense of like gaining weight, let's say, for example. So your body goes through changes extremely rapidly. So there is a lot of muscle strain. So in terms of round ligament, what people perceive as dangerous is you're getting close to the belly. So in other seminars and workshops that I've taken, there is like belly massage, but the massage on the belly, and I know I've done it on you, is very, very light because obviously we don't need to massage the baby. There is no reason to massage the baby. It's something psychological and pretty to look at, and maybe on a more emotional, mental, and spiritual level to feel, you know, the hands on the belly and things like that. But when you're talking about relieving pain, which is, again, most women come in with that hip pain in their glutes and their lower back. The belly really doesn't need to be addressed. Now, when it comes to round ligament pain that's located, can you stand up for us really quick and just kind of show where the round ligament would be? Yeah, that's exactly.
And
Very
this
good.
pulls,
Yes.
it all pulls.
Exactly. So it pulls, and when, as a therapist, when you are working that area, you're really working kind of like that crease in the groin. You're not really moving up to the belly. If you do move up to the belly, it is very, very light work because you're basically just massaging the ligament. But where it's really tugging at is that crease right there. When a doctor may see this and say, oh my gosh, you're pressing on the baby, but that's not really the case at all.
Any mother in her second pregnancy with a toddler will attest that just carrying the toddler is probably far worse.
So physically, when you started, working and receiving neuromuscular work in a safe way, what were the biggest difference that you saw, like right away, that you're like, okay, yes, I want to come back and I see the benefit of this?
I can actually tell if I go a longer duration without having a massage. In the middle of the night, getting out of bed has become very painful. And I was with you yesterday. We had a massage yesterday, and yes. I could get out of bed last night. I had no problem getting up and getting out. My hips were well oiled. They felt good. I could move, and it's a huge difference. And yeah, it's something I'm coming back for because my body is constantly changing and growing right now. But it's a definite difference in my ability to move and my flexibility and all of that.
Have you ever received a negative reaction from prenatal massage or neuromuscular body work? Has anything ever made you feel worried, or other than soreness, have you ever felt like, oh, this was dangerous to my body or to my baby or anything like that?
Never. And if I do have soreness, it's a good soreness. It's like, oh, we worked it good.
Yeah.
So good. No, I've never been worried about any of that.
What would you say to physicians that are well-intentioned, but maybe a little bit afraid of this type of work, and how can they best support pregnant women in their practice?
I would say that this not only helps you physically in more ways than I can really express. It nurtures you in a sense. It provides like physical healing, mental healing. You get to take a break and check out, which is huge. Yeah. You get to be taken care of, and I think it's all around. It's an emotional benefit. It's a physical benefit, clearly, and it's a break. And we as women and moms, it's that's huge for our health. That's a huge benefit all around. To me, there's no negative to this. It's very black and white. A good massage is hard to beat.
Is there anything practical, any tips or any advice that you would give a doctor? Let's say that they were, they had an OB practice and they're like, okay, I'm kind of open to this. Like, what could they do in their practice or in their office to just be more supportive towards women?
Listening probably is a big one. A lot of doctors like to talk at you because they are the ones who did the schooling. But women, we have an intuition. We know what we need, and we know what our body is saying. And I would suggest that they try it and see how invasive the round ligament massage area is. It's not. It's very light. It's very mellow. It's not. It's not scary at all. So I would say to a couple of the more traditional OBs, because my OB supports you. We have your flyers in our office.
Yes, he does.
But to the more traditional, I would say don't knock it till you try it, you know?
Yeah.
Or you know, just a couple of women try it and they can discuss it with the doctor and tell them their experience and how it is. Obviously following through with the mother to birth, and you know, is it a perfectly healthy baby?
Yeah.
Yes.
Yes.
Okay, then no harm done.
Yeah.
Know?
Yeah.
So they're doing they do trials on that stuff all the time. Why not do one on the benefits of neuromuscular massage?
Do you have a message for all the mommies out there that are working hard and, you know, just really are struggling with trying to find time for self-care, or may hold on to these beliefs like, you know, I have to put my family first, or my mom never did anything like this for herself. I certainly don't deserve to, but they are tired and they are hurting. Do you have any message of encouragement for those mommies out there?
As women, we were dealt a lot of responsibility, and raising children and having the children and taking care of the home. And now in today's society, we work. There's a lot expected of us, and you need to focus on yourself, and it's okay to focus on yourself. And once you can focus on yourself and get yourself right, that enables you to take care of everything else better. You know, if you're healthy and you feel good, it's going to reflect out, and you're going to be more patient with your 2-year-old. You're going to be more patient with your husband, you know. I think, women need to be okay to focus on themselves. Not all the time, because obviously that's not possible, but yeah, we can spend a couple hours, you know, taking care of us. And that is important, very important. Taking a break before you hit a breakdown, you know. Exactly. That's what's important. Recognizing like when you need to stop. And it is hardest. And for me too, in particular, it's hard for me to sit down and be still. And I've had to tell myself, Lindsay, you need to just relax right now. You're tired, your body's tired, your heart's pumping. Let's just be still for a little bit. And you need to have discipline to do that. And it is hard as a woman, but it's so important that we do take that time.
Lindsay, thank you so much for your time. Thank you for taking time away from your business and your family to share this with doctors and moms and the birthing community that just needs to hear a voice, just needs a face and a voice to say, okay, maybe this isn't so weird. Maybe this isn't so scary. Maybe we should give this a try.
It's amazing.
Thank you so much. And I'll see you in the next session.
Thank you, Michelle. Bye.